the Association of Resident Doctors, and they said that government is not necessarily doing the needful to take care of these doctors, hence their movement. What exactly, aside from the salaries, what exactly does the Nigerian health sector need the most as we speak? What's the most important thing that they need right now?
There's no most important thing. For you to have a health system that works, you need manpower, you need materials, you need money. You cannot have 2 out of 3. You cannot have any 2 out of 3. You cannot have 1 out of 3. Unless you have all 3 in position and in place, there's nothing you can do. There is nothing worse. The last time I wept at the door of the accident and emergency when the young doctor stood there and said, "Ma, what am I standing here for? If a patient comes in, I know what to do. I don't have the wherewithal to do it." What do you say to such a person? You need to set an IV line and the cannula, just the needle to go into the vein, you don't have. Wow. How much you have all the knowledge in your head and no means of applying it to the patient. Why are we standing there deceiving people that, oh, they've made it to the hospital? There's a doctor standing there. Oh, I see the nurse. And still, their loved one will die. That's the situation and this is reality. I'm not painting a picture. I'm not imagining a scenario. This is what is happening today, every day, and has been happening for months.
Wow.
But yes.
I have seen the business community have a parley with those who are running for presidency in the country. I mean, we're in election season, obviously. I've seen, I think the accountants also do hold a parley. I haven't seen the medical association sit with these guys because we know, whether we like it or not, if one of these people win, then of course it becomes their problem. Why are we not having that parley? Is there any plan to have that parley?
I'm sure now there may be, but we have to remember one thing. The healthcare sector has always been populated by people whose main objective in life is to help others. The healthcare sector, everybody knows. Generations of healthcare workers have known. My father knew, my grandfather knew. You do not go into the healthcare sector to make money.
Absolutely.
You go there because you have an intrinsic nature to help others. So the point for us is that it's not that we are going there to make money. So the politics of it really is beyond us. When you are there battling for life, you are not there to start casting blame and casting aspersions on who did or did not do what needed to not be done before. You are there to save lives. So if we are to take time away and take our attention away from what we need to do, that is taking time and attention away from possibly saving lives. They're not enough of us to do that. They never have been. You understand what I'm saying? And the worst part of it is that we actually have doctors in positions of authority, both politically, economically, and whatnot. If they have been unable to do anything, for whatever reason, what are the rest of us expected to really do? The Association of Public Health Physicians have engaged public people over the years. We got promises and nothing concrete came out of it. You see, because the truth of the matter is the health sector is not sexy. You know, the only sexy part of the health sector is when you build an institution and somebody goes and cuts a white ribbon. There's nothing sexy about saving lives. There isn't. There really isn't. There's nothing sexy about preventing babies from dying, preventing pregnant women from dying. Nobody even wants to know when people who can hardly afford healthcare get sick. Nobody wants to know. The only time the health sector comes under comes to everybody's attention is when big people in government suddenly get sick, like what happened in COVID. Then everybody started running helter-skelter. Too late. Too late.